Hi, I'm Suri Hula, owner at Core Fusion Pilates and Physio. We're going to talk to you today about clinical Pilates. A lot of clients want to know what it is it that we do, what's different about it, and how does it work. So if you look at standard Pilates being fitness-based, clinical means that we just take that therapist edge. So we're looking at you as a physio, looking at how your body, joints, everything works, and then using some exercise therapy as well as treatment techniques to help that. So we've got Cheryl here. What we're going to do is have a little look at how she's standing and how a knee problem or a back problem could change her posture, which then gives her pain, in turn gives her pain. So Cheryl's got relatively nice posture as you look at her from the front view. If for some reason she had back pain, what she might do is, if the back pain's on this right side, is lean away from that back pain to help her. Now, obviously we treat that as a physio and we can do some mobilization techniques, but then she also needs the strength to make sure that her back pain doesn't come back. So we'd have to re-educate her through the core. So that's what we'd actually do with things like the clinical rehab, clinical Pilates side. In terms of the back itself, if you have that ongoing back pain, over a period of time, if you're in that slide off posture, it makes your back feel a whole lot better because you're not putting pressure on it, but over time you get postural changes that mean that the muscles on one side will shorten, so these muscles will become tight, the muscles on this side are going to lengthen. So over time she might get pain again, but not really know why. She hasn't fallen this time, she hasn't had any car accidents or any issues to cause it. Now again, over time, if she has got that slight glide out to the side, she might also start to find that her posture changes lower down. So what she might come in with to see is some knee pain because her ankle's twisted out from the fact that her body's hanging over to the left. So her complaint when she comes in might be, I have knee pain every time I go up and downstairs, my knee hurts. So in our Pilates assessment or in our full assessment, we're looking at not only why has she got knee pain, but what's the knee and the leg doing in relation to the back. So in Cheryl's exaggerated posture, which I've now put her in, you can see that her knee turns out or her leg turns out, puts a bit more stress on this outside side of the leg, means that her pelvis is rotated, and also puts a tightening posture on this side, so the muscles on her right are a little bit shorter, her muscles on her left are a little bit more elongated. So in terms of rehab, what we'd actually be doing is some rehab work to bring her back in line so that she's back to centre, takes pressure off the knee, takes pressure off the back, and then improve her core so that she's actually supporting her body, which in turn will hopefully A, improve posture, B, get her a better core strength, but C, also get rid of that knee pain. So from a very small issue of back pain, over time we can get postural changes that change the length of muscles, length of tissues, tightens them up so they can lead to problems lower down. And if Cheryl decided to go and start running for the City to Surf, she'll probably find that she gets knee pain, shin pain, maybe some Achilles problems, potentially some back problems as well. So worthwhile having a look, if you are getting any of these problems, to see whether it is a biomechanical or whether you just have an issue around the knee. So in a nutshell, with our rehab, we're looking at what's your alignment like? Is there a problem throughout the whole body? Is it just one joint, or is it a joint that's affected and cause postural changes higher up? And then we use the big equipment, or we can use some mat work and exercises to improve that. So in a nutshell, Pilates clinical based, basically a lot of core work, biomechanic changes, being taken through by a physiotherapist if we need to use some hands-on to help you, so some normal joint mobilizations, treatment techniques along the way, then we'll do that as well. But long-term benefits should be a lot more substantial than just treating one problem and sending you away. It's treating the problem, correcting the problem, and making sure you have the tools to sustain and maintain a healthy body. Clinical Pilates in a nutshell. Thanks for watching our video demonstrations that we've just done for you. For more information, you can have a look at our website as listed below, or subscribe to our channel. Thanks again.